thank you very much for this incredible opportunity. It's wonderful to be here tonight, especially because it is Giving Tuesday. I'm going to be honest and go off script for a second. I can't remember being this nervous about a public speaking gig since I worked with Bruce Frisco, because I never knew what he was going to say. So my name is Star Dodson, and I'm with the Mental Health Foundation of Nova Scotia. We're a grassroots organization. We're located in the Nova Scotia Hospital in Dartmouth. The name of our building is the Mount Hope Centre. And the name is very important because there's one key word that drives us at the foundation, and that word is hope. We work to raise awareness and funding for mental health. Each year, our annual granting program helps 30,000 people directly and indirectly to impact 150,000 people. Our motto is very simple. We exist to change the way people think. We want to change the way they think about mental illness, mental wellness, stigma, and most importantly, the recovery process. I'm guessing you've all heard the stat 1 in 5. It's a pretty common stat. 1 in 5 Nova Scotians will be impacted by a mental health concern or an addiction this year. 1 in 5 of the people in this room, let's say. The big thing about that stat is it's this year, not in our lifetime. It means 1 in 5 of us will be impacted. I think that stat is baloney. I think it's actually much higher. You don't have to work in this field for very long to know that there are countless Nova Scotians and people right here in HRM who are struggling in silence. And they're struggling because of the fear and the misunderstanding and the stigma that comes with mental illness. Last year, the foundation received $716,000 in requests for grant funding. We were able to award $200,000. This year, we have received just shy of $1.6 million in funding applications. The numbers tell a story. They tell us that the need right now is tremendous. The numbers have more than doubled in 12 months. Now, we managed to up our funding from $200,000 to $300,000 this year, but it is still nowhere near enough. In an effort to grant more funding, we've come up with a unique program. We're offering named grants. Our small but mighty team of just six and a half employees is now on a mission to find funders for specific mental health initiatives. We're doing that by approaching businesses, individuals, organizations, and communities and asking them to create specific named grants. Needless to say, the opportunity to present here tonight could not have come at a better time for the Mental Health Foundation. If the foundation is the successful charity here tonight, we will use 100% of your donations to create the 100 Women Who Care Halifax Community Grant. We will make it accessible to projects and people in the HRM who are in need of funding for community mental health programs and services. We will use our experienced grants committee to vet the applications and determine the areas of greatest need. And we will do all that next week because we just so happen to have a grants committee meeting scheduled for December 10th, just in time for holiday giving. Simply put, we will use your generosity to inspire others to impact change. We'll be able to share hope. And here's the best part about the grants we award. We're not asking for millions of dollars. If you have $1 million, we'll take $1 million. But we don't need $1 million to have an impact. And I'll tell you why. We're not fundraising for large pieces of equipment or research. We're fundraising to help in any way we can. To help the people in our city who are living with anxiety, depression, PTSD, OCD, autism, dementia, schizophrenia, psychosis, the list goes on and on. Here's an example of one of our grants. There's a woman named Beth who has been living at the Nova Scotia Hospital for 18 years. Every day she wakes up in the same room, she interacts with the same people, and she pushes the same buzzer to get out of her locked unit. She doesn't have a pet, she doesn't get to leave her unit to go check the mail, she doesn't get to decide what she wants to eat when she wants to eat it. But she does get to go to work. Beth runs a coffee hour. She serves coffee and tea for 1 hour each week, and it is what she looks forward to most. It allows her to feel validated and needed. That 1 hour or 1 day once a week is so important to Beth. Coffee hour gives her a sense of belonging, a sense of community, and again that word, a sense of hope. It all happens because of an annual Mental Health Foundation of Nova Scotia grant, and the grant is for $500. That's all it is, $500 a year, and it has that much of an impact on her life. It's one of the smallest grants we give, but it's also one of our favorites. A 100 Women Who Care Halifax community opportunity grant will allow us to create more opportunities in HRM for people just like Beth. I really thank you so much for your consideration, and I really appreciate all of the important work you're doing. Thank you.